This is Radio Health Journal. I'm Nancy Benson. This week, improving healthcare in underserved communities.
Where you live. I mean, in some instances, your zip code determines the quality of healthcare that you have and the access to healthcare that you have.
Saving lives by improving awareness when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Change is what is wild about nature, and we should cherish that and look out for some of these incoming species, the go-getter colonists.
A different perspective on invasive species. Then,
I very often watch students speak and they lose control of their breath. And there's a difference between speaking from your diaphragm and speaking from your chest. And when you speak from your chest, you lose control of the force of your voice.
How do you feel about public speaking? I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
These days, scientists rely on statistics for everything, and the statistics are very clear. COVID-19 has not been an equal opportunity disease. It's hit people of color extremely hard.
African Americans, for example, are 3 to 5 times more likely to get COVID and twice as likely to die from COVID than the rest of the population.
That's Dr. Lance Okeke, Assistant Professor of Medicine and Infectious Diseases at the Duke University School of Medicine. He's principal investigator there for a nationwide clinical trial on a novel COVID treatment. The trial, called ACTIV-2, is working hard to recruit more people of color.
We want to make sure that as we're testing these different therapeutics, that we have a sample population within our trials that's reflective of how the pandemic has affected the U.S. population, but also the global population in general. We want participant base that reflects the populations that are being differentially afflicted by this pandemic to be able to feel confident about how we generalize the results of our findings going forward.
However, it's not just COVID that hits underserved communities with more severe health outcomes.
You know, in some instances, we have African American people dying 30% more often from certain types of cancer than white people do. And the vast majority of that is due to late stage diagnosis.
That's Dana Dornsey, founder and CEO of the Lazarus Cancer Foundation, which seeks to improve cancer outcomes where they currently lag.
It all revolves around, and you know, the buzzwords, social determinants of health, right? That everybody's talking about the social determinants of health right now. And those are the economic and social and physical conditions that influence an individual's health status. So their level of education, their income, their economic stability, where you live. I mean, in some instances, your zip code determines the quality of healthcare that you have and the access to healthcare that you have.
Dornsey says those economic and social conditions may also create practical impediments to care that a lot of us may not consider. People in underserved areas often have to make choices between their own health and the welfare of others who depend on them.
And so if you have a mom who feels a lump in her breast and needs to go have a mammogram, she doesn't know where she can go to have a mammogram. The mammogram may not be covered entirely by insurance, and she doesn't have the money to cover the out-of-pocket expense. She can't take time off from work to go and get the mammogram. The bottom line is she won't go and get it. She will put food on the table for her children.
Despite that, Dornsey says there's often a blame the victim mentality for poorer health outcomes. People are blamed for not coming in soon enough when they have symptoms or for not having enough insurance. The Lazarus Cancer Foundation tries to educate people in underserved areas about their healthcare options and navigate them. The disparities they're fighting have existed for decades, but Dornsey says now at least we're hearing about them.
It's something that I look at as a silver lining of COVID-19 is that people now have become so aware of the impact of health disparities around COVID, diagnoses and mortality, et cetera, for our communities of color. But those same disparities exist in relation to cancer as well.
The ongoing disparities have created a lot of distrust for medicine in the Black community, with plenty of hesitancy about vaccines, COVID treatments, and clinical trials. But Okeke says clinical trials like ACTIV-2 are one way to win back trust.
There is obviously legitimate concern about the rapidity of the pandemic, the rapidity of how we've responded to the pandemic, and obviously that has to be acknowledged, first of all, that yes, this seems very quick, but we had to respond to it quickly. And fortunately, we now have accumulated data that our response, both in terms of vaccination and therapeutics, are safe. And we gathered that information very quickly, but it's definitive in terms of the number of people that we've enrolled in trials, the safety profiles of vaccination, but also therapeutics thus far.
54-year-old Mike McDaniel of Los Angeles found that out firsthand. He was on the ACTIV-2 experimental treatment after contracting COVID in October and being recruited into the trial.
For me, it was a no-brainer at that time. This was back in October. I don't remember what wave of COVID we were in, but things were bad. There weren't vaccines on the horizon. And to me, I wanted to do anything that I could do to help. I and my family had already been infected, so I'm hoping that something good could come out of it. And I did it for my friends, my family, the people I know and people that I don't know, because something needed to get done to make the world better. And when I had an opportunity to participate in my own small way, I jumped at it.
And despite the hesitation in the community about medicine, McDaniel says he hasn't gotten any pushback when he's mentioned he's in a trial. But then he didn't mention it to everyone at first.
I'll be honest, I didn't tell my mom right away because I figured that she might worry. But no, other than that, in our family, there wasn't pushback. I mean, there's a little bit of concern always of the unknown of a trial. But I think I was so positive about it that I really didn't get a lot of pushback from my family.
And McDaniel says he's learned a few things. For example, that any fear about medicine seemed to be misplaced.
This experience is different than I expected it to be. I mean, this is one of the side benefits that I didn't anticipate at all, was that I get to spend a lot of time with medical professionals that I really haven't done in the past. And I've come to really, really appreciate the dedication and compassion that these folks have.
Spreading the word is something McDaniels does readily because he knows it's trusted voices in the community that will turn the doubt about medicine around. Okeke may be a doctor, but he knows it's people who've got firsthand experience like Mike and those who have the ear of the community who will change things in the future.
I think it's well documented that trusted voices matter. That, you trust your doctor, yes, but having it from someone that you feel doesn't have an agenda to try to get you to behave in a certain way has been shown time and time again to work. And so, part of what we've done as the ACTIV-2 Rise Above COVID campaign is to identify those trusted sources within the community, to find out who those people are, and to kind of give them the word about what we're doing in terms of treatment trials to convey to their audiences. And so evidence has borne out that identifying trusted sources are the most effective in terms of student behavioral change in general, but also as it applies to clinical trials and novel therapeutics.
You can find out more about the ACTIV-2 trial at riseabovecovid.org. You can also sign up there for the trial if you've recently tested positive for COVID. You can find out more about the Lazarus Cancer Foundation at lazarus.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA revoked the approval of fenofibrates when added to statins, as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrates, such as Tricor and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, That's itscleartomenow.com.
A recent survey of 2,000 Americans conducted by one poll finds that 98% of Americans think you need more protein than you do. The survey also shows that 55% worry they couldn't survive on a vegan diet based on the amount of protein they think they need. In fact, misconceptions about protein and plant-based lifestyles abound. Only 1 in 3 respondents know that 2 cups of cooked lentils is equal to the same amount of protein in a 5-ounce steak, according to Vegan Strong Assistant Director and strength athlete Danny Taylor.
Most people don't realize that plants have all the protein you need, yet many elite athletes are converting to a plant-based diet because it's helping their performance and strength improve dramatically.
Eating a whole food plant-based diet can meet your protein needs while being affordable and effective. Find out more at veganstrong.com. That's veganstrong.com.
Your brain will thank you if you don't watch too much TV. 3 new studies show that lots of time watching television in midlife may be linked to lower gray matter volume in the brain. In addition, researchers found as much as a 7% greater drop in cognitive function over 15 years. Kelly Petty Gabriel of the University of Alabama at Birmingham is lead author of one of the studies.
Previous studies have shown that exercise supports brain health, and now we know that types of sedentary behaviors requiring little thought, like watching television, may do the opposite. The amount of time spent watching television may be an important lifestyle modification to support brain health.
Gabriel says the level of exercise did not alter the lower gray matter volume linked to moderate and high levels of TV viewing. However, TV habits did not appear to impact dementia risk. The studies were presented at the American Heart Association's annual Epidemiology and Lifestyle Conference.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Remaining undiagnosed is really frustrating on a day-to-day basis.
Living with the uncertainty of a disease with no answers.
Then, to red meat or not to red meat. Find out what's wrong with the nutrition information you use every day.
Folks just throw up their hands and say, gosh darn it, I'm just going to eat what tastes good.
All that and more on Radio Health Journal.